This patient was referred to me for endodontic treatment of tooth number 13. You can see decay into the pulp. So this is an irreversible pulpitis case. Patient had lots of pain as well. Acute apical periodontitis, which means tooth is very sensitive to percussion, and patient complains of pain to chewing to biting on the tooth. So today went ahead and cleaned out the decay, rebuilt that missing wall there, and I have different material that I use for this purpose, either composite or in this case I use Duotemp, which is a temporary filling material. It's dually cured, which means time cures it, and also if you cure it with a curing light, that cures it as well. So take a look at the post-op. And here's the post-op. As you can see, we rebuilt that distal wall, and take a look here. And count the portals of exit for me. There's one right here, there's one right there, and there's one right here that bifurcates again. This is three-dimensional instrumentation, shaping, irrigation, activation, and obturation. AH plus sealer and warm vertical obturation technique. Excellent. Took me about 20 minutes to do this. But if you're a beginner, then time should not be an issue for you. You need to focus on doing it right and properly, and adhering and following the fundamentals of endodontics. What are the fundamentals of endodontics? Rubber dam. No rubber dam, no root canal. That's number one. Use the rubber dam, then remove all the decay, then rebuild the missing walls, because you need an intact pulp chamber, to contain your irrigants. Otherwise, you're relying on the volume of irrigants. Okay, so if you're missing a wall and you want to irrigate with sodium hypochlorite, it'll just run out of the tooth, and you only have a little bit maybe left in the canal. But you want irrigant in the pulp chamber. And also, the other thing is that everything needs to be nice and intact, because then there's a chance that your irrigants, your sodium hypochlorite, can get inside of the patient's mouth. Or the other way around, saliva and bacteria from the patient's mouth can ooze through your rubber dam. You may think that your rubber dam is sealed, but saliva finds a way. Saliva carries microorganisms, and as you're doing root canals, you're just contaminating the whole canal system with saliva and microorganisms. So an intact pulp chamber with 4 walls is very important before you start the root canal. All right. Then, of course, instrumentation. You take a working length x-ray if you don't use a apex locator, electronic apex locator. But I use electronic apex locator. I trust it. And then you proceed to instrumentation using your files, whatever files you choose, whatever files you're comfortable with. You irrigate after each file. You recapitulate, usually with a 10 file. I use a 10 file usually to recapitulate. And I go about 0.5 millimeter beyond my working length just to make sure that I sustain patency throughout the procedure. Copious irrigation with sodium hypochlorite. I use 6%, and then sonic or ultrasonic activation of sodium hypochlorite. Then you dry the canal or canals, and then you can go ahead and obturate with equipment and material of your liking. And then a good coronal seal should take care of everything. All right, very good.